Now let's talk about challenging situations and problematic interactions in care, what some people consider to be problem behaviors: resistance to care, refusals, aggression, agitation, or any purposeless action that is annoying, risky, or dangerous.
So, Teepa, when I hear those terms, I'm either not sure what they mean, or I interpret them as this person is dangerous or hard to work with. And truthfully, that changes the way I interact with them. Instead, let's see if we can look at this as a way people living with dementia are trying to communicate their side of the story, trying to let us know what they don't like, when they don't like what we're doing, when they don't understand what we want, when they don't want what we are offering, when they have an unmet need that we may not have recognized, or when they're trying to deal with a changing brain that is making it really hard to function as they once did or as they wish they still could.
So when we commit ourselves to staying curious, to being compassionate, and truly interested in what might be happening from different perspectives and ability states, we can empower people living with dementia and ourselves in ways that change everything.
To do this, we can use our positive approach to care techniques that have been developed and refined over years of practice. We can only improve the situation if we are willing and able to make a change in ourselves, in our environment, in the task, or in the way in which we are communicating.
Typically, people talk about people living with dementia as exhibiting things like combativeness, resistance, doing things like wandering, eloping, rummaging. What if we worded these opinions as: people living with dementia are showing us that they feel unsafe, that they don't understand or what the care we're trying to deliver. People living with dementia are looking for some place or something or someone, but may not be able to tell us who or what it is. Or maybe someone living with dementia either wants to get out of this location or go to another location of personal significance. People living with dementia might even be simply looking for something to do. We'd like you to reframe your thinking. We want you to ask questions. Is the behavior you're seeing an expression of distress and effort to communicate, an expression of a need or a want, or evidence of discomfort or pain? Does the behavior you're noticing annoy others, pose a risk to that person or to you or to someone else in the environment? Or does it really expose someone to danger or perhaps worsening distress? We can explore this by using 6 puzzle pieces: the person and who they've been and who they are, anything about their body and themselves. We could talk about, let's see, physical health, sensory well-being, and mental health. What about their brain changes, their gem states? Those are 3 pieces, and now we have 3 more. Stakeholders, us and the people around, the environment, and then there's time. How do we fill 24/7? Schedules, routines.
You want to know what is the cognitive status of this person, and that includes what losses they're exhibiting and where they are in their gem state. Is it changing? Is this typical or atypical? You want to know about the person. What is their history? Who have they been? Who are they? Where have they worked? Where have they lived? What did they do? It may help you see that behavior in a different light, maybe understand it differently.
Look at the schedule. Look at how people are spending time. When is this behavior happening? Could it be that there's just a lot going on and it triggers a negative reaction? Could it be it's not part of a new normal or new routine? Take a look and see.
look at the environment. Is it possible that there's too much going on in the environment, too busy, or too little going on? Are there visual cues that tell the person to do something, or are there missing cues that don't give that person enough information and so they miss it? Look at whether or not they have a medical condition, a sensory loss, or a psychiatric condition that might be making them behave in this way, that might be contributing to the underlying ongoing problem.
And now for a hard one, look hard at yourself, at your approach. Be honest. Could you have done something that might precipitate this behavior, this interaction? Or did someone else in the environment approach them in a negative way? Say something or do something that actually got the person to react, to do that. People living with dementia are doing the best they can. Once you've looked at all these puzzle pieces, all these 6 pieces, do you have a better handle on the situation? Now it's time to problem solve, to brainstorm a plan. What are you going to do? How are you going to intervene? You want to make sure you have a very concrete and detailed plan.
And that is going to include who is going to do what, where this is going to happen. Are there things that need to change either in the environment or in the timing of the day? Once you figure it all out, implement it, try it, you're going to need to try it more than one time.
Yeah, it may take many attempts to figure out exactly how to make all the puzzle pieces come together to fit. It's a complex puzzle. If the challenge happens less frequently or less intensely, it's actually time to celebrate. You made a difference. If it gets worse or it doesn't change, go back and re-look at the situation and the puzzle pieces. You may have missed something. If you use this technique, however, you can successfully help deal with what others call problem behaviors, and we recognize as challenging care situations. Our goal is to improve interactions, care, and the quality of life for everyone involved. Each person was a unique individual prior to developing dementia, and there are many types, forms, and causes of dementia, and dementia progresses over time, and abilities can change both in a day and in a year. So it's important to realize that when you've met one person living with dementia, you have met one person living with dementia, but when you meet them a second time, they may be the same person, or they may have changed some or a lot. It's vital to use your skills to determine what their abilities and inabilities are in that moment.
And Tifa, we are human too. We have abilities and inabilities that will vary over time and in different situations and with different people. So it's really important to look in the mirror and consider the possibility that part of the challenging situation is us and how we're doing in that moment.
Yes, it's an incredibly important consideration that is missed all too often, that before we can expect to take care of someone else, we need to take care of ourselves. Build support systems and self-care routines. Get enough rest and make time to take care of your own body, your brain, and your spirit. We've covered a lot of information today. We've talked about what is dementia, what are its symptoms and its implications. We've taught you how to approach and communicate. We've also talked to you about how to help, how to create meaningful days that have value for people living with dementia. Finally, we had to learn to reframe our thinking about challenging care situations. It is not going to be easy. I hope now, though, you believe that these people living with dementia are truly doing the best they can, and it's going to be your job to decide to make a difference. You're incredibly important in these people's lives. And you got to decide to take the challenge.
Because it's going to take lots and lots and lots of practice. And one of the good things about people living with dementia, they'll give you lots of opportunities to practice and try again. Please agree to take the challenge.
Can you change your habits? Change how you go about offering support, providing care, when you choose to see things differently, say things differently, do things differently. Everything can and in fact will change. Challenges become opportunities to explore what's possible for you and those in your care. Thank you.
I prayed for it to be gone.
You pray for it to
But
be
I don't
gone.
think my prayers have been worked.
You don't think so?
I don't know how that's going, so they can get out.
All right.
And I appreciate this.
Bye-bye.
Bye.
I know that was not what you were planning to do, but I appreciate you going with it.